everyone, my name is Lillian. I recently graduated from medical school at Columbia, and next month I'll be starting my residency training in obstetrics and gynecology, more commonly called OBGYN, which focuses on women's health care. So today I thought I would talk to you a little bit more about how I decided to become a doctor, and specifically how I chose the field of OBGYN. I grew up in Michigan, and throughout my schooling really enjoyed science and math. Science was never something that came easy to me though, but because I was interested in the material, was willing to put in extra time and energy into really learning it well. I remember really enjoying experiments in chemistry class and doing dissections in biology and just anything that was really hands-on. One summer during high school, while I was visiting my grandparents in China, I also had the opportunity to shadow a doctor there. He happened to be an OBGYN, and he took me around the local hospital, and we saw a lot of different patients and cases, and I also got to go to the operating room and see my first C-section, and that experience really piqued my interest in pursuing a career in medicine in the future. For college, I attended Northwestern in Chicago, and I studied biology and global health. Prior to going to college, I really had no idea what public health entailed, but I quickly learned that public health really focuses on examining the factors that contribute to the health and well-being of populations, which ultimately affects the health of individuals. And I think right now is a really unique time and a great time to be talking about public health and learning about public health because we are in the middle of the COVID pandemic. And so epidemiologists and other public health researchers and public policy advocates have been doing a lot of work in studying the spread of the coronavirus and how we can limit the impact that it has on communities in the United States and across the world. So during my senior year of college, I was trying to think about what I would do next. I knew that ultimately I would probably want to go to medical school, but also felt that I wasn't quite ready to apply at that time. So I decided to first go to graduate school and pursue a master's of public health. I studied epidemiology, and I think taking this path really allowed me to kind of decide and define what I wanted to include in my future career. So after 2 years of graduate school, I got my master's, and then I went right to medical school. Med school was extremely challenging, but it was also a time where I learned not just about health and disease, but really how to interact with other people, how to care for patients, how to communicate not only with patients and their families, but with my teammates and coworkers, and how to work effectively as a team. As medical students, we have the opportunity to rotate in a bunch of different specialties, but OBGYN was one that really stuck out to me from the beginning. So OBGYN has kind of two different parts. The first is obstetrics, which is the care of women during pregnancy and also through labor and delivery. And I think being able to help a woman through the delivery process and be there when the baby is born is just one of the coolest things, and I really look forward to be able to do that in my career. The other aspect of OBGYN is gynecology, which focuses on women's healthcare throughout the course of their lives. So we see women for women visits, but also manage hormone imbalances and menopause, treat gynecologic cancers, prescribe birth control, and talk about family planning as well. I really love that OBGYNs get to see patients in a clinic setting on an outpatient basis, but then we also see patients in the hospital, and we work as surgeons and spend a lot of our time in the operating room as well. Something that's really important to me is that OBGYNs are also actively involved in patient advocacy, which is helping to influence the laws and policies that affect our patients' lives. So I'm going to be spending the next 4 years training as a resident physician in OBGYN, and I know that there will be a lot of new challenges ahead, but I'm really excited to be doing what I'm passionate about and I hope that by listening to my story today, you have an idea of a field that you may want to pursue as well.